Hello everybody and welcome back to another anatomy tutorial. Today's video is the first in a series of videos where we're going to be identifying and examining the arterial supply to the upper limb. Now it makes sense to start at the origin of that arterial supply, the subclavian artery. Now I've drawn this diagram here to highlight the difference between the right subclavian artery and the left subclavian artery. Now we know that off the arch of our aorta has three main branches, the first being our brachiocephalic trunk here. Now that then divides into our right subclavian artery and our right common carotid artery. On the left hand side, our left common carotid artery and our left subclavian artery branch directly off of that aortic arch. Now I've drawn two other structures in this diagram, our first rib here and our anterior scalene muscle. This anterior scalene muscle comes from the cervical vertebra heading towards and attaching to this first rib. Now we use this first rib and this anterior scalene muscle to divide the subclavian artery into three separate parts. The first part of the subclavian artery is everything before the medial border of this anterior scalene muscle. So on the right hand side, it's from the bifurcation to this medial border, and on the left hand side, part one of the subclavian artery comes from the aortic arch all the way to the medial border of this left anterior scalene muscle. The part of the subclavian that lies posterior to that anterior scalene muscle is known as our second part, or part two of the subclavian artery. From that lateral border all the way out to the lateral border of our first rib, this is the third part of our subclavian artery. Now this is a front-on view. This is a good view to remember when we're looking at our coronal planes scanning through a CTA of the head and neck. Now if we were to look from an axial view, looking from the top here, this is the right-hand side of the patient. We have our brachiocephalic trunk separating into our right common carotid artery and our right subclavian artery. And we can see that anterior scalene muscle sits anterior to that subclavian artery, and it divides the subclavian artery into our first part, second part, and then our third part ends at the lateral border of this first rib. It then becomes the axillary artery. Now most of the branches, most of the time, will come from this first part of the right subclavian artery. And I'm going to examine the four main branches that come off this. And the best way to learn these branches is by looking at the sagittal view, by cutting this right subclavian artery or the left subclavian artery in the sagittal plane and seeing where those branches come off. Now, whenever we're looking at arterial supply anywhere in the body, there's a lot of variation generally between people. And I'm going to show you in the example today two variations of the branches coming off the subclavian artery. So let's cut that subclavian artery in sagittal section and look at it from the sagittal view. Now you'll see this looks a little complicated, but these are the only arteries that we need to remember when looking at the branches of the subclavian artery. Now if you're studying for your part 1 exams, the way that these questions generally get asked is either you're asked to label the subclavian artery or you're asked to label one of these four main branches that come off the subclavian artery. Very rarely will you be shown a diagram that's pointing at one of these distal branches and asked to name it in isolation. What I've seen before is you're asked to label this branch and then asked to list the branches that come off. So it's really important to remember the names of these branches, but when we're given one slice on an image, generally we won't be asked more than to identify these main branches coming off. Now I've labeled these branches 1, 2, 3, and 4, and that's generally the order that those branches come off from medial to lateral on our subclavian arteries. Now we're going to spend some time looking at CTAs, and I want to get used to identifying these four main branches. Now the first branch that comes off the subclavian, the most medial branch, is the vertebral artery. Now our vertebral arteries are going to ascend in the neck through the transverse foramina of our cervical spine, eventually joining with the contralateral vertebral artery and forming the basilar artery that runs along our clivus. The second branch is an inferior branch. This heads off into the thorax. It's known as our internal thoracic artery, a really good artery to become familiar with identifying. We then have a very short trunk that comes off anteriorly from the subclavian artery. Here is the anterior side of our patient. Here's the dorsal side or the posterior side of our patient. Now this anterior branch is known as our thyrocervical trunk. Now we will look at these branches later on that head off to our thyroid gland, then that head off to the cervical spine. And then we've got lateral branches that we will spend some time identifying. There's a posterior branch that comes off, generally the last branch that comes off, and this is what's known as our costocervical branch, or our costocervical trunk. And that has a branch heading off to the first and second rib, the costo part of our costocervical trunk, and it's got a deep cervical artery heading off into the neck. So we're going to look at a sagittal view first and identify these branches before having a look at our coronal view and an axial view. And then I want to go through an arteriogram of the upper limb and show you how the orientation changes when we're looking at those images. But before we move on, let's identify these branches that we're going to look at in our coronal and axial views. So anteriorly here, we've got our thyrocervical trunk. Now our thyrocervical trunk gives off a more medial branch here, and that bifurcates into our inferior thyroid artery, which has this characteristic shape. It loops back on itself. It looks like a shepherd's hook. And then it sends off a small artery into the neck, known as our ascending cervical artery. Now these lateral branches here coming off of our thyrocervical trunk are the most variable when it comes to identifying these arteries. Often the dorsal scapular artery or the superficial cervical artery will come directly off of the subclavian artery. So it's generally best to find those distal arteries and work our way back, see where those are branching off. They don't always branch off the thyrocervical trunk. So let's start by having a look at our sagittal view like this and trying to identify these four major branches on a CTA of the head and neck. So here we have a sagittal CTA of the head and neck. We can see we're in the midline. We can see our sella here, our larynx here, our sinuses here, our cervical spine with our C1 wrapping around the dents of our C2. All of these anatomical structures we've covered in previous talks. So if any of this looks foreign to you, I'd highly encourage you to go back to those talks and check them out. Now what I want to do is scroll out laterally until we can see some of the branches of the aorta. Now as we scroll out laterally, we can see our aortic arch here giving off a branch. This is our left common carotid artery, which we can see bifurcates into our external and internal carotid arteries. And we know that if we come more laterally, we'll get our left subclavian artery. So this is our left subclavian artery. The more lateral we go, we can see our descending aorta heading down into the thorax and eventually into the abdomen. So here is our left subclavian artery, and we want to identify the first branch that comes off the superior aspect, our vertebral artery. So we can see here our vertebral artery heading off into the neck. We know it will traverse the transverse foramina of the cervical spine. Look at that, going all the way through these transverse foramina, eventually looping around into the foramen magnum, heading up towards the clivus where it joins its contralateral vertebral artery and makes our basilar artery running up that posterior surface of the clivus there. So that's our first branch, our vertebral artery coming off our left subclavian artery. So let's get back to our subclavian artery, and I'm going to head out more laterally and we'll see those three other branches that I mentioned earlier. So here's a great slice to stop at. The second branch that comes off is this inferior branch, our internal thoracic artery, heading along that posterior surface of our anterior thoracic wall here. Then anterior to that is our thyrocervical trunk. We know that our thyrocervical trunk gives off our inferior thyroid artery, our ascending cervical artery, as well as those lateral branches. And we'll look at all of those branches when we look at our coronal and sagittal cuts. And then we can see this posterior branch here, our costocervical branch, giving off two branches, one going to our supreme intercostal and the other wrapping around posteriorly here and heading up into the neck, our deep cervical artery. You can see it heading all the way up here, wraps round that transverse process there, and then heads up into the neck, our deep cervical artery. Now, I often find it really useful to look at the sagittal first, identify those four main branches, because now when we're scrolling through our axial slices or through our coronal slices, we can get an appreciation for where those branches are. Is it a superior branch? Is it an inferior branch? An anterior or a posterior branch? So let's have a look at our coronal images here. Now the first thing I do when looking at a coronal image is to identify the first rib and identify the anterior scalene muscle, then we can divide our subclavian into its 3 separate parts. So let's scroll anteriorly on our image here and try and identify our first rib. Here we can see our first rib, our most superior rib. Follow that rib around and you will see it wrapping anterior to this left subclavian artery here. That lateral border there identifies the junction between our left subclavian artery and our left axillary artery. As we head more anteriorly, we should see here our left anterior scalene muscle coming and attaching to that first rib. You see how that anterior scalene muscle lies in front of, there, going in front of that left subclavian artery. Anything behind that anterior scalene muscle is part 2 of our subclavian artery, and anything more medial than that is our first part of our left subclavian artery. So let's find the origin of the left subclavian artery. Here it is coming off of the arch of the aorta. Now our first big branch that comes off superiorly is our vertebral artery. We can follow that all the way up through those transverse foramina, heading round, wrapping into the foramen magnum here, heading up, joining its contralateral vertebral artery, forming the basilar artery at the top. Let's go all the way back down. We've identified the first branch. Then we know if we scroll more anteriorly, we will see that internal thoracic artery. So let's scroll anteriorly looking for an inferior branch coming off. There it is. There's our internal thoracic artery heading along that posterior surface of our anterior thoracic wall here. Now we know we are anterior to our left subclavian artery, so while we're here, we know the next anterior branch is our thyrocervical trunk. Here is our thyrocervical trunk. We can follow its branches. Here's the medial branches, our inferior thyroid artery that wraps, has that shepherd hook shape, and our ascending cervical artery. We can see it bifurcating. Here's our inferior thyroid artery, and lateral to that, this small artery, is our ascending cervical artery. Let's follow that inferior thyroid artery heading into the anterior portion of the neck and then hooking. You see it hooking around like that, supplying the thyroid and some of the anterior neck structures. There's our inferior thyroid artery. If we head back, we can see, follow up here, our ascending cervical artery heading up. There it is coming down. Now our thyrocervical trunk also has lateral branches. As we scroll anteriorly, we can see that this lateral branch wraps around the anterior part of that anterior scalene muscle and then heads out to the peripheries here. And this is our suprascapular artery that we mentioned earlier. Now we're going to look in the axial planes. It's a lot easier to see those lateral branches and see the variations, of which there is one in this image. Now the last major branch coming off of the subclavian artery is our costocervical, the posterior branch. So we need to scroll posteriorly, and there is that posterior branch, our costocervical artery or our costocervical trunk, that gives off our supreme intercostal artery. You can see that's thin artery going that way, supplying the blood supply to the first and second ribs. And then this deep cervical artery, which will wrap around that transverse process here and head up into the neck, our deep cervical artery. Let's have a look on the axial arterial phase. Scroll right down to the arch of the aorta. Now, the reason I'm sticking to the left-hand side is we've got all this contrast and the artifact associated with on the right-hand side. When we look at our last image, I will show you the differences that we see on the right-hand side. So let's see our 3 major branches, our brachiocephalic trunk, our left common carotid artery, and our left subclavian artery. Let's follow that left subclavian artery up, and we should see the first branch that comes off of the left subclavian. Here is our left vertebral artery. Now I'm not going to follow it all the way up, but we want to see that left vertebral artery entering a transverse foramina of one of the cervical spines. There it is. We know that that is our left vertebral artery. Let's go back down. We know that the inferior branch of this subclavian artery here, as we scroll down inferiorly, that inferior branch is our internal thoracic artery, and that heads along that posterior surface of our anterior thoracic wall. There it is, the internal thoracic or internal mammary artery. Let's head back up to our subclavian artery. We know that the anterior branch is our thyrocervical trunk. Now our thyrocervical trunk gives off lateral branches, and it gives off those medial branches, the ascending cervical and the inferior thyroid artery. So let's go superiorly and see those medial branches. Here we've got our ascending, very small ascending cervical artery laterally, and our inferior thyroid artery medially. Let's follow that inferior thyroid artery as it wraps around medially, and then we can see it hook around like that, hooks into the thyroid gland there, supplying blood to the thyroid, the parathyroids, as well as many of these anterior neck structures. There is our inferior thyroid artery. Here is our ascending cervical artery that is bifurcated from that thyrocervical trunk. Let's go back down to that thyrocervical trunk. We can see the lateral branches, and here there's just one lateral branch that heads out to the periphery, which is our suprascapular artery there. So then let's go back to that thyrocervical trunk. There should be a posterior branch. Here's the posterior branch. We know that posterior branch gives off our supreme intercostal artery, and if we follow it around, there's our supreme intercostal artery. As we scroll up here into the neck, we should see that head out posteriorly. We should follow that deep cervical artery all the way up into the neck. There is our deep cervical artery, and later we're going to look at this superficial cervical artery that we can see lying underneath our trapezius muscle, both on the left and the right hand side here. Deep cervical artery, superficial cervical artery. Let's go back to our subclavian artery now. Find it there. So we've got our vertebral, our thyrocervical trunk, our costocervical trunk, as well as our internal thoracic artery there. Now, on this axial view, we can identify our first rib. That lateral border of the first rib identifies the junction between our subclavian and our axillary, and we can see our anterior scalene muscle here running anterior to that subclavian artery there. Here's our middle scalene, there's our anterior scalene, and our subclavian artery intersects the two. So anterior to it is our anterior scalene, separating the first and the second part, as well as the second and the third parts of our subclavian artery. Now, what we haven't identified is our superficial cervical artery and our dorsal scapular artery that runs along the medial border of our scapula. So here we can see it running along the medial border of our scapula, our dorsal scapular artery. So let's try and follow that dorsal scapular artery back up into the neck here. And what we can see is that dorsal scapular artery actually branches directly off of the third part of our subclavian artery. This is a common variant here where the dorsal scapula comes directly off of that artery. And if you notice here, as we're scrolling out to that dorsal scapular artery, we can see another branch being given off here, which is our superficial cervical artery. If we follow that all the way around, we should see that superficial cervical artery lying underneath our trapezius there. There's our superficial cervical artery. So in this patient, our dorsal scapular and our superficial cervical actually come off the third part of the subclavian artery. Now I want to show you one more image, and that is a CT angiogram of the entire upper limb. Now a patient sitting like this within the CT scanner, so you can see how the orientation of these arteries has changed. Their arm is no longer on their side like this. Go to our axial slices. Now this is the right arm of the patient. So we are dealing with a brachiocephalic trunk prior to the bifurcation of our right subclavian and our right internal carotid artery. So let me scroll all the way up into the neck here. We will see our lung fields coming into view, and we want to find the arch of the aorta here. So as we scroll superiorly, here are our three branches, our brachiocephalic trunk, our left common carotid artery, and our left subclavian artery. Now we're dealing with the right-hand side here, so our brachiocephalic trunk should bifurcate into a right common carotid artery and our right subclavian artery. So here's our right subclavian artery, here's our anterior scalene muscle, and as we scroll out to the periphery, here's our first rib, which marks the end of our right subclavian artery. So again, let's go and identify those four branches quickly. The first main branch that comes off our right subclavian artery is our right vertebral artery, heading up towards those transverse foramina of our cervical spine. There's our right vertebral artery. Inferior to that, our internal thoracic artery heading down. This is becoming easy now. With repetition, we can start to see these branches. Superior and anterior to that, here is our thyrocervical trunk. This one is quite superior on this patient. Our lateral branches heading out that way, and our medial branches heading this way towards our inferior thyroid artery. See how that inferior thyroid artery hooks around like that? And we've got our ascending cervical artery more laterally heading up into the neck here. Head back down. Let's have a look at those lateral branches. We can see them heading around, one giving off our suprascapular artery and another heading off towards our superficial cervical artery. Here's our superficial cervical artery. It's tortuous. We can head it all the way around, and we can see it lies beneath that trapezius muscle here, our superficial cervical artery. On this image, we see that our suprascapular artery goes to the suprascapular region, but also gives off our dorsal scapular artery here that runs along the medial border of our scapula down here. That's a slight anatomical variant. Our dorsal scapular is coming off this suprascapular artery here. Let's head our way back to that thyrocervical trunk, find our subclavian artery here, and the last branch we're looking for is that posterior branch, our costocervical artery coming off here. Costocervical artery wraps around here, gives off our supreme intercostal artery as well as our deep cervical artery. We can see our deep cervical artery wrapping around that transverse process, heading into the deep regions of the neck here. There is our deep cervical artery there. So you can see the orientation is slightly different when the patient's got their hand raised in the CT scanner like that. But if we systematically look for our vertebral artery, our internal thoracic, our thyrocervical, and our costocervical trunks, we can then follow those arteries throughout the head and neck. Now again, I want to stress for your part ones, knowing the anterior scalene, knowing the first rib, and knowing the divisions of the subclavian artery are going to be very high yield pieces of knowledge. Then knowing those four major branches is really useful, and knowing the distal branches. It's often asked in exams to name those distal branches. You're very rarely given a slice like this saying label this artery here because of that anatomical variation. If you don't have the ability to scroll, it's quite difficult to identify those arteries. So it is a bit of a complicated artery, many branches coming off a very small space, but it's important anatomy to know, especially when going into your clinical practice. Now that subclavian artery, it exits the thoracic cavity, the thoracic inlet, before heading out into the arm. Now when we're dealing with a stab wound up in this apical region here in the neck, we need to remember that that subclavian is often injured because it comes out of this thoracic inlet, much like the lung in the apex here heads out of our thoracic inlet. It's a really vulnerable spot when it comes to traumatic injuries, and that's why this region becomes incredibly important to know the anatomy here. So I hope you found that useful. Our next talk, we'll be looking at the next part of this artery, the axillary artery, and its various branches as it heads out towards the upper limb. So I'll see you all in that video. Goodbye, everybody.